The latest figures from the NHS in England show that ambulance service response time performance has improved month on month. And also, the ambulance hours lost is also improving month on month as well. However, we do fully acknowledge that there are rising pressures facing the service, and there are three significant factors influencing this. First, bed occupancy, which is currently around 93%, which is something we'd normally see around winter times, is influencing this. We know that there's high rates of COVID admissions in hospital, whether that's people with COVID or because of COVID, and that puts pressure on A&Es to be able to admit patients. We're roughly running on void beds of around 1,200, and part of this is because there's a 16% increase in length of stays. We also have the pressures of delayed discharges, but they remain flat, but a significant influence. But also, we have record numbers of calls to the ambulance service, at 100,000 more calls compared to May last year. So there is significant pressure on the system. As well as that, we also have to be mindful of the weather in the coming days. We do have a heatwave plan for England, which was published earlier this year. I'm sure the honourable gentleman has read it. And we also have the hot weather plans the NHS trusts have also put in place. In addition to that, we're providing sector-specific guidance, setting out the best way to protect people who may be at risk. But we're also supporting the service more widely to make sure it's got the resilience it needs. We've allocated £150 million of extra funding for this year for the ambulance service, and we're boosting the workforce too. National 999 call handler numbers have risen to nearly 2,300 at the start of June, which is a considerable increase on the previous September. And we're on track to train 3,000 paramedic graduates nationally per year, every year until 2024. And on top of this, we've invested £50 million in NHS 111 to help give extra capacity to the service. I will be meeting all 11 ambulance trusts over the coming days to make sure that they have the capacity and resilience they need, not just to deal with the pressures now, not just to deal with the pressures with the warm weather, but to prepare for the winter pressures that we know will be inevitable and forthcoming. This is an important issue which I take extremely seriously, and I will keep the House updated as the situation develops.
Thank you, Mr. Speaker. Last October, I revealed through a parliamentary written question that every ambulance service in England was at the highest alert level. We are now 9 months on, and we are in that situation again. We're now facing warnings of extreme weather this weekend. The government needs to reinstate the funding for discharge packages into social care homes. We need primary care to be used to stabilise people in communities, and we must be using first responders from the fire service. Will the Minister agree to convene an urgent meeting of COBRA today to protect patients and paramedics who are really operating at the brink?
So, can I say to the Honourable Lady, we have put additional investment this year, over £150 million of extra funding into the ambulance service to help them meet the demands, because they have got significant demands. And for this time of year, these are the sort of rates that you would normally see in winter. And we are doing exactly that. We have got our heatwave plan, which was published earlier this year. We are confident and working with all NHS trusts to make sure that they have got the support that they need, and all the ambulance trust too. But can I just gently say to her, this isn't just about funding. This is about bringing care together to ensure that those hospital beds are freed up, so when ambulances arrive at A&E, they can unload their patients. And as I said to the Shadow Minister, I'm not sure if he's take me up on this, I am happy to work with every single member across this House to make sure that we support our emergency services.